Hello, I am Dr. Andres Mambuca. Today we are going to delve into an essential topic, autism, not seen from the perspective of behavior but from the nervous system. Welcome to this space for deep learning. Often, what we see as bad behavior or a tantrum is actually a cry for help from a nervous system that is trying to communicate something that words cannot express at that moment. It is important to remember that the brain is incredibly plastic. Neuroplasticity tells us that with the right support, we can help the nervous system develop new and better ways to process information. One factor that is often overlooked is the gut brain axis. The health of the microbiota directly influences mood and the sensitivity of the nervous system in people with autism. An undetected internal discomfort in the digestive system can manifest as external irritability. Understanding this biological connection is fundamental for a comprehensive approach. Returning to the direct causes, sensory overload is the most common. Imagine that all sounds and lights reach our brain multiplied by 10 without any filter. When sensory processing fails, the nervous system enters a state of emergency. Disruptive behavior is simply the result of that inevitable internal collapse. We must also consider physical pain. Many people on the spectrum have difficulties with interoception, which prevents them from clearly locating or communicating a specific ailment, from a simple toothache to a migraine. If it can't be expressed in words, the nervous system will communicate it through restlessness, refusal, or extreme irritability. Anxiety in the face of uncertainty is a constant factor. For a person with autism, an unexpected change in routine can feel like a real threat to their own well being. This anxiety creates a constant internal tension. Disruptive behavior is often a desperate attempt to regain control in an environment that is perceived as chaotic. Let's talk about the difficulty in expressing basic needs. We're not just talking about asking for water, but about expressing internal emotional states that are extremely complex to process. When there is a deficit in functional alternative communication, the body takes on the task of signaling that something is wrong. It is communication in its most primitive and honest form. Emotional fatigue is a daily reality. The effort to adapt to a world that does not understand their needs quickly exhausts the person's neurological resources. A child who has been masking or holding it together all day can reach a saturation point where any small demand triggers an intense emotional response. Sometimes the behavior is a mechanism to escape from a demand that is too complex. It's not a lack of willpower, it's a momentary inability of the system to process that load. If the demand exceeds the processing capacity at that moment, the nervous system forces a necessary pause through avoidance or escape behavior. That is why it is vital to provide functional communicative alternatives. If we do not proactively teach how to ask for help or a break, the nervous system will continue to use the behavior. Tools such as augmentative systems or constant emotional validation can drastically reduce behavioral crises and improve everyone's quality of life. Having a team of specialized professionals, such as behavior analysts and clinical psychologists, is essential to design an intervention plan that respects the individuality of each nervous system. Our goal is to empower families with tools based on evidence and humanity so that the home becomes the safest and most understanding refuge for the person. In summary, autism requires us to always look beneath the surface. Every gesture and every behavior is telling us a story about that person's nervous system. I want this video to be the beginning of a real conversation between us. I know that every family and every case is unique and that you have many valuable experiences to share. That's why I warmly invite you to leave your comments down below. Tell me about your daily challenges, your doubts, or any questions you may have in mind. I want you to know that I will personally read each of your messages and respond to you myself. Your voices are the most important thing for continuing to build this educational channel. If this content helps you better understand your children or patients, please subscribe to the channel. Your support is what allows us to keep creating this material for free. Thank you for your time and your commitment to neurodiversity. I'll see you right now in the comments and very soon in the next video. A big hug.